Hello, my name is Kelsey. I am an occupational therapy intern at the Cancer Support Center, and today I'm going to share with you a presentation I've created regarding sexuality and body image. If you are new to the Cancer Support Center, we'd like to welcome you and share with you a little bit about our approach to cancer support. We use this 5-point approach to target all of the areas of wellness and quality of life. So our services fall under one of these categories: counseling and stress management, physical fitness and wellness, nutrition, education and networking, and body image, which is where our presentation today falls under. So in our discussion today, we're going to be talking about these key topics. The topic of sexuality and body image are massive topics. And again, there are lots of things that can be addressed. But these are the kind of most common questions or concerns people have regarding sexuality changes after cancer treatments and how that affects body image. So these are what we're going to focus on today. I just wanted to share a statistic before we get started that according to the National Institute of Health, about 40 to 100% of cancer survivors have reported a problem with sex after treatments. So this just goes to show that this is a pervasive problem. And if you have been struggling with body image or with sexuality, you're not alone. It is a very common issue that needs to be addressed. And many people don't seek help for these issues because they're ashamed or uncomfortable. They're not sure who to turn to for help, or you're busy surviving and prioritizing other areas that your sexuality or body image can fall to the wayside. So this presentation is just to kind of bridge that gap and help answer a couple of those questions for you. Again, like anything, be sure to be talking to your doctor and oncologist about your sexual activity. It's important to keep your doctors up to date on everything that you are participating in, just so they have, the clear sense of how you're doing. And in some cases, it may not be medically safe for you to engage in sexual activity with or without a partner. So just be sure to collaborate with your doctor before taking any of the steps we mentioned today. And when talking with your doctor, just know that you are not the first person to bring up these issues to your doctor. It's much more common than you would probably think. And doctors are trained to talk about sex with our clients. So, make sure you have those conversations. And hopefully this helps you to not feel ashamed or make them a little less awkward. So the first thing we're going to discuss are physical changes. So how cancer itself or its related treatments can physically affect men and women and their sexuality or body image. So for women, some of the possible changes can include a loss of breasts due to mastectomy, scars, vaginal dryness, pain with intercourse, a decrease in sex drive, as well as a decreased sensitivity or sexual response. You may have fatigue, you may have an ostomy bag or drains, and you may have developed lymphedema. Again, these are not the only possible things, but these are some of the most common. So we'll be addressing some of these. And then again, these are some of the physical changes that may affect males. So this could be erectile dysfunction, a loss of testicle or both in some cases, a lack of sex drive. You could have scarring, dry or backward ejaculation in some cases, a loss of sensitivity or sexual response, fatigue, weakness, or ostomy bags. Again, it's not an all-inclusive list, but these are some of the most commonly reported problems. So the first thing that we're going to address is that vaginal dryness that women can experience. This can be due to chemotherapy, hormone treatments, stress, age, lots of different things. But it's a common problem that women dealing with cancer do report. So simple ways to address this are to use a moisturizing lubricant. And the best one to use would be a water-based one, just because that does provide the most moisture for you. And try to avoid words on labels such as parabens, glycerin, petroleum, and mineral oils. Those can be found in lubricating products, but they're just not the most kind of pure and kind of healthy for you, especially if you are going through a cancer treatment. You want to make sure what you're using and putting around your body is healthy and safe. There also are some silicone lubricants, and if you use kind of a nicer high grade one, those can reduce friction, so that can help with that dryness and some of that pain with intercourse that can come along with some of these treatments. So some people suggested even layering the moisturizing and the silicone one if you're going to be having penetrative sex. And there are lots of articles on this online too, if you need specific suggestions. Also, just sort of increasing foreplay before any penetrative sex, can just help get your body sort of ready. And again, if you do that with these lubricants, that has been shown to help tremendously. Another area we're going to address is erectile dysfunction. This is, again, a very common issue for men in general, but also certain types of cancers and their treatments can produce this as well. So one of the easiest things to do is to just not have to rely on an erection to pleasure your partner or yourself. So if you have a partner, you can use, sex toys, dildos, fingers, other things like that to, penetrate your partner instead of the penis if you are having trouble with erections. And then for yourself, sort of try and see other areas of your body that may kind of have a sense of arousal if, that is something that you're struggling with in that area. We talk about this a little more at the end of the presentation too, kind of finding areas on your body that you have pleasurable sensations too, since sometimes, people think the genitals only because that's kind of the basic thing people think of for pleasure. So we try and open that up and broaden it a little bit, especially if you are having some dysfunction in those areas. There are also ways to address erectile dysfunction. So there are treatments for penile rehabilitation, some pelvic floor exercises. There's some surgical interventions or medications can help reduce symptoms. But again, please talk to your doctor before these are used, because your doctor can kind of guide you in the right direction for that, or send you, to a specialist for this, since some of those can be invasive. So we want to make sure your doctor knows what's going on there. And then fatigue is something that men and women can both struggle with from life itself, or especially cancer treatments such as chemotherapy, radiation, all of those things. So this is one of my favorite areas of occupational therapy. It's important. You may need to budget your kind of daily energy supply that you have to allow you to have enough energy for sexual activity. So there are ways that we can help you achieve this, and there are 5 P's. So it's prioritizing, planning, positioning, pacing, and a positive attitude. So number 1 is just prioritizing sex as an activity if it's important to you, or to your partner and yourself. So if you think that this is something you want to do later in the day or in the beginning, kind of plan a light day around this so that you make sure you have enough energy to give to this activity. And then, like I said, planning. So you may see that you have more energy in the morning or at night or mid-afternoon. So kind of seeing when you have the most energy and then planning sexual activity during that time so that you make sure you will have enough energy to enjoy it. The 3rd P that we have is positioning. So if you are kind of dealing with some fatigue or, pain, anything like that, positioning can be very important for that. So your partner may need to take the more active role in sexual activity if you are kind of having a more fatigued day. And I go into this a little bit more in a future slide too. Actually, it's the next slide. The fourth is just pacing yourself. So whether that's during the day or during sexual activity itself, just making sure you have enough energy for all of the activity and not kind of using all of your energy in the beginning, just to kind of keep yourself at an even pace. And then a positive attitude, can just be being easy on yourself, knowing that fatigue is a very common issue that people going through cancer treatments or even years later, cancer-related fatigue is a big issue. And so if you are fatigued, kind of let yourself feel fatigued and give yourself breaks during the day. Let yourself kind of prioritize things and be patient with yourself. And, during the moment of sexual activity, be present, enjoy yourself, and know that it's okay to prioritize this because it is something that is kind of thrown to the wayside so much when other things in life are going on, but it can be helpful and healthy to your daily routine or weekly, however often you see fit. But it is important to address these needs. So here's our slide on positioning more in depth. So again, you may need to change up positions for fatigue. Like we mentioned, your partner may need to have that more active role, or you may just need change in positions because maybe positions you used to use now may be uncomfortable, painful even, or just unarousing now. It also helps just to be creative with positionings in a relationship or by yourself, just to keep things interesting. And, if your sensitivity has changed, if your sex drive has changed, it can be helpful to kind of experiment with different positions to see if maybe something now feels better or more painful. So I have a list or a link at the bottom, which has a list of hundreds of different sexual positions, and it can be filtered into different categories, which is really helpful. So you can choose, if you're the active partner or the other person, and they have ones that are lying down, sitting, standing, all these different things, so that you can kind of tailor your experience to what needs that you have. The next thing we'll discuss is a lack of sexual drive or lack of sensitivity. So this can be a side effect of many medications or treatments, or just fatigue itself or body image and emotional struggles. You may just not have the energy or the kind of desire for sex like you used to. And then your sensory sensitivity can also be affected. So like I said in the last one, certain positions or sexual acts that used to kind of give you that pleasure feeling may have changed because of some of the treatments or medications. So something we do to address this is to use a variety of your senses to produce arousal. So, we have 5 senses. Be sure to use all of them. So, this can be, using music to set the mood, physical massage, aromatherapy for smells. Lavender is a smell that often calms people down, but can also produce arousal, or flowers, things like that. Some people, bring food into the bedroom or wherever you're having sexual activity, or use foods, that have an aphrodisiac quality. And then, for certain people, erotica, so books, magazines, videos, pornography, to kind of add to that sensory experience can be helpful as well. So definitely be creative with some of these things because it can help just kind of you feel that pleasure in different ways that you may have not thought of before. And again, sometimes people notice when they dress in something that makes them feel confident or sexy, they have a little bit more of that sexual drive. So that is something that you can look into as well. And then meditation or relaxation, either before treatment, or before sexual activity or during. Sometimes just keeping yourself relaxed and in the present moment, not thinking about, what else you need to do or your medical struggles that you're going on, kind of really enjoying the moment can help you enjoy that moment a little bit more too. And then sometimes it may be helpful to just change your goals or expectations of sex itself. So it may not be about penetrative sex now or about orgasm. Maybe it's to help you feel connected to yourself or your partner or partners. Maybe it's for stress relief. There are many studies that show that sexual activity does, produce hormones that help us de-stress. Or it could be expressing love, or, maybe this is helping your body image to, get more in touch with your sexuality. There are many things that this can now kind of be helpful for, and it may be different than what sex used to mean to you. So it's okay if that has changed a little bit. So now we are talking about some emotional concerns that can come with cancer or treatment. And there are many of these as well. So this is not an all-exclusive list. But again, body image can change when your physicality changes. Some of the things we mentioned before, those physical changes can affect your body image. You may have a lack of confidence because of hair loss, scars, loss of organs, things like that. You may be in grief or denial about your diagnosis, have sadness or depression. That lack of sexual drive is an emotional concern as well. Disassociation is something that people have often reported, which is where you kind of, as a coping mechanism, sort of distance yourself from the body that is now ill and making you sick. Some people kind of distance themselves from their own body, and that can make sex kind of difficult because you really don't feel a part of your own body anymore. You can also just feel betrayed by your body, because it is sick or not functioning the way it used to. Many people report that they feel like less of a woman because they don't have hair or their breasts or eyelashes, things like that. Or it happens to males as well, especially with the erectile dysfunction or a loss of testicle, things like that. And then, you can think of yourself as defined by the cancer. So I'm a sick person. So your kind of entire role now in life is a patient or a sick person. So you may not kind of value sexual activity anymore because you're focused on you're a patient, you're sick. So there's just some concerns that can come up in this area. So a way to address some of those concerns that we talked about on the last slide is just to give yourself time to grieve and to, accept your new body, your new life with cancer. And sometimes this takes a long time. You may not be ready to jump right into sex after a diagnosis or right after treatment, and that is okay. If you have partners involved, you may need to discuss this, and tell them that your needs have changed a little bit because your, body image or just emotions right now need to be focused elsewhere. And, that's okay. But, you can grieve what you used to look like, what things used to be enjoyable. And it may take a little trial and error to see when you are ready to engage in some of these activities again. But, don't give up on it. If sexuality is something that is important to you, definitely don't give up on it. But you may need to give yourself some time to adjust to some things like this. And then counseling can be very helpful, either individual or couples counseling, to help kind of work through some of those feelings of that body betrayal, grief, that self-esteem, feeling less like a woman or a man. Sometimes it helps to kind of talk that out with your partner or with a counselor. And again, these are not the first times that counselors would hear of these concerns. They're, again, like from that statistic in the beginning, very prevalent and, can be very distressing to individuals. So it's important to go get help for that if you think it could be helpful. Support groups can also be helpful for this because you can hear other people that are dealing with similar emotional or physical concerns. And then journaling has been shown to help cancer patients kind of improve their body image and work through some of those emotional concerns. So if that's something that you would like to try, definitely give that a try. So this slide talks about how to improve body image, again, because some of those physical changes or emotional changes can really wreak havoc on your sense of self and your body image. And having a healthy image of yourself and body image is important to sexuality and you enjoying that activity. So it's definitely important to improve our body image when we can. So again, giving ourselves time. Most people are not comfortable right away after treatments. It takes people normally a while to get used to the hair loss or to mastectomy scars or, anything that changed, having an ostomy bag, all those kind of things. Most people, even the most confident people, it takes a little bit to get used to your new body, and that's okay. You don't have to feel okay right away. It doesn't make you vain if you are upset that you don't look the way you used to. It's a normal coping mechanism to feel upset for a little bit. So give yourself that time. Also, looking in the mirror and using positive affirmations. So some people think this is kind of cheesy, but it does really work. Looking at yourself and saying, I am beautiful. I am strong. My body is helping me survive. I, am sexy. All these things, using them when you look at yourself and when you talk about yourself to others, it helps. The more you say these affirmations, the more you can start to believe them. And then again, we talked in an earlier slide, but wearing lingerie or clothing that makes you feel a little sexier does help your body image, but also wearing clothing on parts of your body, if you're showing parts of your body that aren't very comfortable or, showing a scar might be a little bit too much for you right now. So wearing clothing that does cover scars or, changes in other parts of your physicality or keeping lights off during sexual activity can be where you need to be right now. That, you may not be completely comfortable with your body and you need to kind of fake feeling that confident and sexy for a while is okay. And yeah, nothing wrong with that. And then this is where occupational therapy really comes in. Engaging in your meaningful hobbies and meaningful roles of life help to improve your body image. So dancing, journaling, like we said, cooking, anything that is meaningful to you that gives you a sense of confidence that, that is a big part of your life. If you're a runner, if you go run, you're going to feel more confident about yourself because that is something that you value and enjoy. And then another thing kind of for affirmations is listing things that are sexy about yourself, especially non-body related things, because, that mirror does not define who we are. I like to say my body is the least interesting thing about me. So naming some things that you think are attractive about yourself that have nothing to do with your body can really help you build that confidence from the inside out. So, your sense of humor makes you attractive to people. You're a kind person. You're a good dancer. You can cook, things like that. Kind of remembering that we're more than our outside bodies can be helpful. So this slide talks about how cancer treatments can affect someone's partner. So again, cancer sort of affects all those around you in different ways, even if they're not the person receiving treatment. So if you have a partner, whether it's a serious one or just a casual one, they can be affected by your cancer journey too. So again, it's important to notice how this affects you but it may be affecting your partner as well, and maybe worth kind of talking with them about to see if any of these issues are, coming from their end. So it can be difficult for someone to transition from partner to caretaker. So if they are helping you, during those times where you don't feel well, it can be hard for someone to kind of switch from, someone's partner to a caretaker role. They could be worried about causing you pain, with sexuality, if you haven't discussed that, or if they don't know if they're causing you pain, that can be on their mind. They might not want to feel like they're pressuring you. So if they have sexual needs that, you may not be ready to fulfill, they don't want to feel like they're pressuring you back into it. They may be unsure if you are ready to jump back into sex or how your body image is. They may feel guilty about having those sexual needs when, they're so used to putting you first and, how you're feeling and taking care of you. They may feel selfish about, still having sexual urges, which is a very normal human thing to have. They may have a hard time with your new body as well, or, your changes in, sex drive or things, especially if this is a partner that you've had for a long time. They may be grieving your old, body or your old sex life also, which, is okay as well. And, most likely they're dealing with their own grief or anger about the situation or sadness, about your treatment and diagnosis. So it's important to, of course, take care of yourself, but also kind of talk to your partners about how this may be affecting them as well. So to address some of these issues from your end or your partner's, really talking with your partner and being honest is the most important thing you can do. Your partner can't read your mind. They can't, you can't read theirs either. So it's important to share any concerns or sexual needs or questions honestly and clearly so that you can both kind of move forward and meet each other's needs. So this just shares a couple things that can be helpful when you talk with your partner about these issues. So definitely communicate your desires and needs. If you are wanting to get, back into sexuality after treatment or something, talk to your partner and tell them that you are ready for that. Or if you're not, because having that kind of tension there or just not addressing it can be hard on both parties. So just being honest about what you need and what you need from the other person is very important. And then, explaining the fatigue or pain that you have and kind of working together to find times that work best or positions that, can help both of you, that can give both of you that pleasurable feeling and have those needs met. And then this is one that has come up many times from people I've spoken with, is that just kind of discussing what is comfortable or not. This is important in any sexual situation, with consent and things like that. But with the cancer part of it, there are things that your partner or you may have questions about. So one that came up for someone I talked with was this partner was not sure if, they should touch their wife where their breasts once were after she had a mastectomy, or, because that was what, he was used to doing, or will that make her sad if when he touches there, there are no breasts there. So, he hadn't discussed it with her because he wasn't sure what she felt. But because you didn't know, that's really when you do need to talk to your partner and, just make sure you both know what you're comfortable with. And maybe you won't know, it's possible that she doesn't know if that would make her sad or not. So that's where some of that trial and error comes in, and not kind of giving up if, you have some of those hard emotional feelings during sex, not giving up forever then. This may take a little bit to get used to again. And then going on dates or having, romantic private moments with each other aside from just sexual activity to kind of help ease that caregiver to partner transition. So, especially if you are needing some assistance from your partner at this time, just kind of telling them, I love you, or, just kind of planning things that they don't have to be extravagant, but just kind of so that they don't feel like caregiver all the time and then partner just in the bedroom. So kind of just keeping that with your partner can be helpful and can help ease burnout for them as well. And then this slide is about self-love. This is something I've been mentioning throughout the presentation. I've been saying whether you have a partner or not, because self-love, which includes masturbation or kind of just exploration and self-discovery about your own sexuality, is important for everyone. Again, you don't have to follow everything in here, but it may just be helpful for you on your own to kind of just explore your body, areas that you feel pleasure or that are painful, uncomfortable by yourself. Sometimes it's easier to do that and then to just share with your partner those things. Or again, if you don't have a partner, it's important to, kind of have these needs met in any way that you can, because again, they are very healthy for you to express sexuality. But this can be just a good way to improve your body image by yourself first, because you're not using another person's opinions of you. It can be helpful to, kind of explore sexuality by yourself and be confident with yourself first. So this was a technique that I found from a woman who had breast cancer and then decided to go into sex coaching. So she talked about the technique called pleasure planning. So this kind of can just help you understand your body and enjoy sexual experiences again. So the first thing was a weekly date with your partner or yourself. And she recommended that this be a no expectations date. So, whether you go out to dinner or watch a movie together or by yourself, don't have the expectation of sex afterwards, but this is just kind of about enjoying yourself or your partner and doing something fun, romantic, or just pleasurable, just to kind of keep that in your schedule, to do something fun for yourself or your partner kind of can ease you back into, healthy sexual experiences again. And then the second was focusing on all of your senses, which we mentioned a little bit previously. But again, getting creative with all of those 5 senses, because just, physical touch during sex may not be enough anymore, or your changes, may have decreased that sensitivity. So you may need to kind of mix and match things with taste, touch, smell, sound, and sight. And there are lots of things online too that discuss a bunch of ways you can use all sorts of senses too. And then 3 was just getting to know your body. So again, kind of on the last slide, either using, masturbation or just kind of self-discovery, or just kind of being patient with yourself and your self-image, kind of working on that through the counseling or journaling, doing the affirmations, but just kind of getting used to your body again. And then the 4th was making a pleasure map, which I go into detail on in the next slide. But it's a visual map of your body and areas of pleasure, things that are not comfortable, that you can use with yourself or share with your partner. And then the 5th was just committing to pleasure. And she mentioned that in any sense. So, eating things that give you pleasure, going on walks, anything that kind of gives you a happy feeling is important to keep in your routine, especially when you are going through a difficult, medical time. But also kind of being sex positive and knowing that it's okay to have these desires and, being comfortable with that and talking with your doctor about it, talking with your partner, and not feeling ashamed about this, which, society kind of sometimes sees this as a taboo topic, but it's something almost everybody in the world does. And it's important to talk about it because a lot of people have issue with it, like we saw. So it's important to discuss these things. So this slide talks a little bit more about that pleasure mapping technique from the last slide. So really, the gist of it is just drawing or printing out, little body outlines, and writing down things that you like, areas that are, pleasurable for you, areas that you don't want touched or that are uncomfortable, and what kind of sensation too. So, like these say, light scratches on the lower back are good, or, tongue in the ear is nice, and you can kind of circle and write what you like, or maybe, penetrative sex is not comfortable, so you kind of make a little X there, but write other areas, that you have found things pleasurable. This can be where you add some of those sensory things too. So maybe, warm towels on, your back or something, or warm water is a nice feeling, or ice or something. Or you can write on the sides, that you like a certain kind of music to be playing, a certain sound, or, a certain scent to be in the air. So this just kind of can be a nice guide for you or a partner to kind of show areas of arousal or pleasure or things that you're not comfortable with. And this can help make those conversations a little easier too, if you have a visual to show the other person. And it can be something that you change, maybe for a while something is painful or, not comfortable. And then you try it again later and it's comfortable, or vice versa. So it can be kind of a living document. So these are just some places to go for further resources. Again, most people don't search or kind of seek out resources for this because they don't know who to turn to. So there are many medical and professional people that can help you with any kind of sexual issue that you're having. So of course, I, as an OT student, am going to tell you to go to an occupational therapist. But we do consider sex as a daily activity, even if you're not doing that daily. But we put it on the same kind of importance level as going to the bathroom and showering, that people need to know how to do this to, have meaningful life if this is meaningful to them. So we try to help people, be able to enjoy this and adapt it to any of their needs that they have. Then there are also sex therapists, which, their specialty is sexual activity. So they can kind of help in an individual or couple setting to help you work through some issues. Again, talking to your oncologist or primary care doctor, just to keep them in the loop. And they may be able to refer you to some of these specialists as well. And they can tell you if medically there's a reason why you should not be having sexual intercourse because of your treatments or things like that. So always good to keep them in the loop. Gynecologists or urologists are another place to go, especially if you're having some of those vaginal dryness or erectile dysfunction issues. Going to a specialist for that, they may have some better interventions for you for those things. Again, going to counselors, psychologists, people, to talk through some of the emotional issues can be very helpful. There are programs such as the one at University of Chicago. Their PRISM program is all related to women and sexual health. There are other ones too. If you look it up or again talk to your doctor, they can send you in the right direction for people that are specifically trained to help in these areas. And then again, online discussion or support groups can be really helpful so that you can talk to some people who have been through the same emotional or physical changes that you're going through, and you can ask them how they dealt with it. So these can be great places for that. Peers can be a good, they know exactly what you're going through. Some of the doctors or therapists, they know how that can affect you, but sometimes talking to someone who actually is going through it is the most kind of relevant way to get any advice there. And that is all. Here is the contact information for the Cancer Support Center. Again, we have services such as counseling, support groups, and lots of things like that that can help you deal with some of the issues that are discussed in here. But yeah, I hope that this was a helpful presentation. Thank you for listening. And I hope that this presentation was, it at the very least showed that you're not alone in this, area, that there are many people that have issues in the same area, and that it's okay to ask for help about it. It's okay to prioritize this in your life. And yeah, because it's an important thing. So hopefully this helps. And please reach out to the Cancer Support Center if you have any further questions. Thank you.